It's fall of 2022 in Düsseldorf and I just woke up from general anesthesia from my second surgery in Germany. After the anesthesia wore off a little bit, or maybe because of the anesthesia, I realized in that moment, wait, we should do a video about this. Now, to give you context, my very first surgery was in summer of 2020, and my second one, as I said, was in fall in 2022. So the very first thing we're going to talk about is the German health system.
Now, the benefit of having a social health system like the one in Germany is that if you're publicly insured, yes, you do pay for it. Well, that's not true. Privately, you pay for it also every month. But you pay for it every month up front without really using it or needing it. But that system is there to catch you if you do need medical assistance.
Other important aspects to point out is that yes, because we do pay into the public health system constantly, I mean every month, this also means that I don't have to worry financially when going into surgery or having any other medical procedures. That is amazing because we've heard from other friends that either a family member has surgery and the whole family is under so much stress because they don't know how they're going to afford it, or they have to struggle or get a loan to pay for it. And in this case, the stress is gone because you know that the system is there to help you and it's not going to break the bank. Additional to that, in Germany, for example, you also have the right to rest after a surgery with paid days. So your employer can't fire you and they need to pay for the time that you're recovering, which is pretty awesome.
Now, please bear in mind that everything that we mention in this video is based on a planned surgery, so not for emergency surgeries, of course.
So the very first thing that needs to happen is that you need to define, or the doctors need to define, if you need a surgery.
So the process could look anything like this in order to get a diagnosis. First, you need to, you will most likely have some sort of condition which will make you seek out the advice of a doctor. Typically, that could be your Hausarzt, so your family doctor in Germany, who, depending on what your condition is, might refer you to some sort of specialist. You will then make an appointment with a specialist and seek their advice. If the specialist advises you that the surgery would be the best idea, they might actually recommend a hospital or clinic to go to, because also hospitals and clinics are specialized in certain areas, which you can then contact to ask for a consultation. Once you have that appointment at the hospital or clinic for the consultation, you will meet most likely the surgeon, who will do another examination of you and your condition to verify that the previous diagnosis is actually true and whether he agrees or she agrees that the surgery is the best course of action. Should that be the result, then most likely you will proceed to find a date together with the surgeon and the nurses that the surgery will take place. Depending on the urgency, this could be rather fast, or it could be weeks or even months, depending on your own schedule in terms of maybe family, job, or vacation plans. The surgeon, of course, will also inform you on the type of surgery, whether it will be an inpatient or outpatient treatment. So inpatient, the German word for that is stationär, which means that you spend at least one night at the hospital. And outpatient, the German word would be ambulant, which means you go in, have the surgery, and walk out the same day.
Now, from my experience, when I got the diagnosis, I went to a clinic and a hospital to have consultations there. That is also the cool thing about the health system, that you're also allowed to get second opinions, and it's covered also by the insurance, right? So I went to both and both agreed, yes, I do need the surgery. And what was interesting is that at the clinic, the surgery would be ambulant, meaning that I wouldn't stay there a night. I could stay there one night, but I had to pay for it extra, like 75 euros or something like that.
Because it was a private clinic?
Right. And the hospital for that same surgery, they recommended that I needed to stay at least 3 days at the hospital. Super different information, right? So I decided to go to the hospital for multiple reasons. Number one is that I wanted to take as much rest as possible in a hospital or clinic because the surgery was going to be in my abdomen area. So of course you have to be very careful with movements or a lot of stress on your body. And there are 99 stairs between the door of our apartment building and my couch. So I didn't want to put my body through that on, like, let's say the same day that I got the surgery. And number two is that if in case there would be anything emergent or super emergency during the surgery, could go wrong during the surgery, I felt that the hospital was better equipped to respond to that just because they have a lot more equipment and more doctors in different areas as well to their disposal, let's say, of course, if they would be available. So at the end of the day, I chose the hospital because of that. Again, this is from my experience. It's important that if you're going through this process, you gather as much information as possible for yourself so you can weigh the options and choose what is best for you. Now, if you're curious, Jen, what kind of surgery did you have on your abdomen? Well, we will make another video where we will talk into detail what my diagnosis is and what the whole let's say, emotional experience of that was. So stay tuned for that one. Now, what happens days before the surgery?
Most likely, if you're having a surgery in a hospital, you will be asked to come a day or two beforehand back to the hospital to have some preparation tests. Those tests could include, but are not limited to, for example, a urine test, a blood analysis, a PCR test, and other tests for typical hospital viruses.
In my case, I also had to do the check-in in like a reception area where you pull a number, you wait for a very long time, and then you get to speak to a receptionist, or like, I don't know if receptionist is the right word actually.
Well, it's the Anmeldung.
It's the Anmeldung, the registration office, let's say. And during that process, they asked for my health card, for my Überweisung. It's Überweisung, not Rezepte.
Yeah.
I get those confused sometimes.
So the referral?
The referral, exactly. And they printed like 1,000 stickers. Just kidding, it's like maybe like 20 stickers with my name and birthday and information, which I think it's used for like the urine test and blood tests and whatnot, and as well as a bracelet that I was going to be wearing for my stay in the hospital.
Depending on the hospital, you may also need to speak to the anesthesiologist in advance. And depending on the type of hospital, whether the anesthesiologist is also on call for emergencies, that talk can be very fast or can take hours until the anesthesiologist is released from surgery. So the hospital, in our case, reminded us to please be very patient, bring a lot of time. And in Jen's case, there were water, snacks, and a very good book involved.
Yes, and in total for both times, I waited around 3 hours. So I would say, of course, a hospital doesn't have just one anesthesiologist, there are multiple, but sometimes it does happen that all of them, for whatever chaotic reason happens, they all need to be rushed into surgery for an emergency.
Right, and in this conversation, it's mainly to highlight the risks that any surgery will have, regardless of what it is on, just because of anesthesia.
Exactly. Another interesting aspect is private versus shared room in a hospital.
And this highly depends on the hospital, but also a little bit on your insurance. So if you're insured with public health insurance, most likely you will have a shared room. And depending on the setup and your day of surgery, pretty much, you might get a 2, 3, or 4 berth room. In your first surgery, you had a 4 berth room in a rather, let's say, typical hospital room that is not the most modern. And now last year in your second surgery, you had a 2 berth room in a very modern, newly built wing of the hospital. So of course, those were 2 very different experiences.
Yes, additional to that, so we have to say that if you have a public health insurance, there's like this add-on that you can buy to have access to private rooms in a hospital.
And the Chefarzt that operates on you, it's called Krankenhauszusatzversicherung, so literally additional hospital insurance.
Yes, and also if you're privately insured, then your likelihood of having a private room is a lot higher.
It depends on the tariff that you book, because that actually also is often in tariffs a deciding factor, also kind of like how high the price per month is.
Fair point. However, so we asked in the hospital that I stayed at if having a private room would even be an option. And the way the nurses responded was more like, hey, this is an emergency hospital and it's kind of like a first come, first served kind of basis.
You get what's available that day.
Yeah, so they didn't even ask if I had an add-on or privately. They didn't even ask about that.
Well, we were willing to even pay for it from our own pocket, right?
Yes. However, they just
it was
pretty
not
much
an
said
option.
yes. So I think it also depends on the hospital whether you can even access or unlock that option for you. Yeah. Now, before you go to your surgery, of course, you need to pack your surgery bag. You need to come prepared because, of course, the hospital will give you a very beautiful gown that you can use during surgery and a little bit after recovering. However, it is okay and allowed that you can change into more comfortable clothing. So make sure to pack clothes that you feel comfortable in if it's summer. Most likely the hospital might not have air conditioning or the room that you're recovering in. So maybe bring very airy and light summer clothing. And if it's winter, heating will most likely be on. However, one of your, roomies might, as a good German, want to open the windows during winter for some time to, air the room, as they say. And in this case, then bring some snuggy clothes with you.
Just be prepared, like have something of everything. Because, for example, last year you asked me to bring your shorts because it was warmer than expected.
Yeah, that is true.
Yeah.
That is also true. That is a fair point. Additional to that, of course, bring your hygienic products. It's okay to brush your teeth, put on deodorant. Sometimes even showering might be allowed.
Depending on what your surgery is.
Yes, and depending on the day. So I stayed 3 days and I was only allowed to shower on the day that I was being released. And for that, the nurse had to prepare certain things just to protect my wounds, I would say. But it's totally possible.
Yeah. Also super important for your hospital bag is snacks. Because hospital food is a little bit notorious. We'll go into that later on a little bit more in detail. But just be sure to have snacks available that you like, that maybe give you a happy mood. Maybe also like some minties, anything that kind of like helps you pass the time.
Yes, passing the time, entertainment is super important. So if you love reading, bring a nice book. I brought a book and like a device that I could watch Netflix offline. Without that, I don't know if I would have survived, to be honest. And of course, headphones, because if you want to watch stuff, it's better. A, it will prevent you from disturbing your roomies or your neighbors. And B, in case your roomies or neighbors are being loud, you can also listen to your stuff without, being distracted all the time. Now, one of the questions that I had, I arrived to the hospital with my hospital bag. In this case, I just packed my hand luggage, the one that I travel with usually. But then the question is like, well, how am I going to access this stuff later?
Maybe a big tip here, because the first time around we packed a backpack, which was not the smartest choice, because in Jen's case, she wasn't allowed to carry things after surgery. So how do you carry a backpack out of the hospital?
Yeah.
Because I wasn't allowed to visit. We'll get into that in a little bit later. Second time around, we were smarter and packed the hand luggage, which was able to roll.
Yes, exactly. Yeah, very good point. So usually what happens is during the surgery, you have to put your stuff away. You can't bring your phone for the surgery room. I don't remember if the first surgery I had a safe vault. I don't think so. But the second one in this fancy new wing, there was even like a vault that I could put my belongings with the code and everything.
And even a fridge.
Yeah, that was super cool. However, usually what happens is that if there's no vault within your room, then you can ask the nurse where you can put your valuables, and they might have something that is locked either in their nurse room or something like that. Anyways, what I wanted to say is that your stuff gets put away. Your nurse usually has a key. And whenever you wake up from anesthesia and you're back in your room, you can kindly ask the nurse if they can help you get your most valuable stuff or the things that you need. In my case, it was my phone, because I needed to inform Ivan and others that the surgery was well and I was awake. Because in my kind of surgery, the doctors didn't call anyone to let them know, oh, by the way, Jan is now out and ready in the bedroom.
Yeah, which maybe leads to the current situation that we were in 2020 and 2022. First off, that to have also the pre-tests and everything, one needed a negative COVID test. But also for visiting, for example, in 2020, I was absolutely not allowed to visit, which sucked. To be frank. So I was reliant on Jen being able to operate her phone to let me know that everything went well, so that I could let everyone else know that everything was well. And then we just FaceTimed every day. Whereas in 2022, I was allowed to visit every day in certain visiting hours. Yay! However, I was not allowed, the surgery was in the morning, I was not allowed to wait in the hospital for the surgery to pass. So I was again sitting at home waiting for that text message that said everything was going well, except that this time there was a delay, and actually the end of the surgery went into the visiting hours. So I just went to the hospital, expecting to know what's going on, which was a good thing, because the anesthesia hit you a lot stronger. And literally, I arrived when you were rolled into your room and you were in no shape of handling your phone.
That is a very fair point. So the first time the anesthesia was fine. Second time around, I was a lot more nauseous, I would say, a little bit more out of it. And during that, I had the revelation we should make this video. Now, the day of your surgery, what to expect on this day. So most likely you will be asked to be at the hospital very early in the morning, even though your surgery is not scheduled for that time. In my case, I was asked both times actually to be at the hospital at 7 a.m. And because I was going to undergo general anesthesia, I couldn't drink or eat anything after midnight the day before. And the anesthesiologist said that a schluck Wasser before 6, a sip of water or something before 6 a.m. was possible, but not too much. So the first time I was there at 7 and the surgery was at 9:30. And the second time around, I was also asked to be there at 7 a.m., but my surgery was only until 12:30-ish. So that was a little bit harder to maintain, a peace of mind with an empty belly and of course a very dry mouth. A book was very helpful during this time because I could totally, disconnect from the fact that I was starving. Now, what happens after you wake up? I think this highly depends on the hospital, the time of day, because I had two very different experiences. The very first time I woke up in a very peaceful room, and then the nurse, or I think the anesthesiologist, I was out of it, so I don't know exactly, came to me kindly and asked how I was feeling, and they gave me an ice pop to suck after the general anesthesia, because usually they intubate you as well, if possible.
And they also kept you in the wake-up room for a bit longer, no?
Yeah, they kept me for like 15 minutes. I cannot tell because I was under the influence of drugs. But the second time around, I woke up, and I have the feeling that I woke up, the nurse came, pushed me to my room, and that was it. I didn't get no ice pop or nothing, and it was like a lot more hectic. So I think it also depends maybe on the time of day and also the amount of staff they have. I don't know. So it can go either way. Now, once you're in your room, then most likely pain will come after a surgery. And here comes a very interesting point that we like to talk about, and that is pain management in Germany. So NALF, if you don't know him, he's a YouTuber / American football player in Germany, made a video about him having a surgery in Germany as well, and how he was shocked by the lack of opioids that are given out in hospitals after surgeries. What does he mean by that? So you can watch the video, we will link it in the description box below, but he goes into a mini rant saying that how in Germany, when you wake up from a surgery, you only get ibuprofen, versus in his experience in the US, opioids are giving out a lot quicker and a lot faster, which statistically speaking also means that a lot more people get addicted to this medication, which is horrible, right? And I will confirm with his experience that after the surgery, all I got was Ibu, as they call it, right? And that is kind of like what you get. And it's expected that you will have some pain and that you kind of have to like deal with the pain as long as you're not crying and it's like the super horrific thing that you feel like something is going to fall off. And if you want harder medication, usually nurses are not allowed just to give it to you. They need to consult with the surgeon. The surgeon needs to probably examine you, and it's like a whole process. And even if they would give you harsher medication, I kind of doubt that the first thing they would give is morphine or something like that. They would try to maybe escalate it into levels to see how far they can get. Of course, I think this also highly depends on the surgery and the severity of your wounds, right? Again, this is a planned surgery, so we're not talking about emergency cases. At least in my case, I got packages delivered to me during the morning and afternoon, and these packages had my name and the date I should be taking the Ibu, out of which, to be honest...
Date and time,
yeah. Out of which, to be honest, I maybe took 50% of the medication that they gave me, because the rest I wasn't in such a big pain or discomfort that I needed medication, which was kind of surprising, I would say.
Now, it's usually quite common that any surgery where you have general anesthesia, that you will also get sexy thrombosis socks. Here's a picture of Jen in sexy thrombosis socks. Yeah. And also, of course, a daily thrombosis shot. Now, in the hospital, the nurses will come and give it to you. If you are at home because you had an outpatient procedure, then you will require to give them yourself. For example, my dad with the one surgery had to give him himself.
Now, another thing to point out is food. If you're going to stay in the hospital for a few days, I think this also highly depends on the hospital. This, again, I'm talking from my experience. And the food where I was at was... I don't even know. I have to be honest, it sucked, to be honest.
So the first time around, I couldn't visit, so she just had to suck it up. The second time around, actually, one day it was so bad that I brought her and her neighbor her roomie food from home.
Yeah, so this shows because my neighbor, German as she was, she couldn't also eat the lunch. That's how bad it was. It wasn't like, oh yeah, you're international and you don't know what's good in German. No, she couldn't also eat it as well. So, but I would say, for example, your dad, when he had surgery in Bonn, and he was raving about the delicious food he had in the hospital.
So it really depends. But in my opinion, I'd rather have very friendly nurses like you had, and a seemingly very good surgeon like you had, than good food, right? I mean, rather this way around than having great food, but maybe not so friendly nurses or
friendly doctor.
Yeah.
I would say the ideal case would be everything, the whole package, right? But also talking about friendly nurses and friendly doctors. So it's very interesting because the surgeon that operated on me, he spoke English fluently. I did my very best to speak German, but there are certain terms that I cannot understand in German just because medical, right? So he spoke fluent English, as well as the assistant surgeons, or I would say the apprentices or whatever. And some nurses spoke some English, although I would say depending, but most nurses spoke more German than English.
But they tried.
Yeah.
They gave their best effort if they noticed that, there was a little bit of a miscommunication or something.
Yeah, they were like super friendly. I would say I think the friendliest people I've found in Germany, well, one of the friendliest has been in this hospital. Everyone is so nice and so kind. It was really a very beautiful experience despite the whole medical circumstances around it.
So that is kudos to all the nurses out there. Thank you.
Thank you for your work. So after the time that you're supposed to stay at the hospital goes by, there will be a release date that is planned for you. And before you get released, you will most likely be examined again by a surgeon to just make sure that your wounds are healing nicely. And in some cases, maybe other examinations will take place. And if everything looks good, then they will give you the release note. And with this release note, you show it to the nurses and you're able to leave your quarters.
And in German, that is the Entlassungsbrief.
Yes. Additional to that, they will proceed to send your medical data through snail mail to the doctor that you put in the form. So most likely the specialist that recommended you to take the surgery, to also for them have records of what happened in the surgery and how things were and went and so on.
However, you should also take that Entlassungsbrief to your follow-up appointment, which you will most likely have.
Yes, that was going to be the second point. Depending on the kind of surgery, I think, your surgeon will ask you to do a follow-up appointment with the specialist to, again, do a checkup in, let's say, 2 weeks or a certain amount of time afterwards.
Now, the big question about the cost. I mean, we already answered it in the beginning of the video, but just to give you, again, a better understanding of the procedure. So if you are publicly insured in Germany, you will pay 10 euro per day. It used to be per night, now I think it's per day in the hospital, which, I mean, that is a bargain.
Yeah.
Never forget that you are prepaying any procedure, whether it's a surgery, a doctor's visit, or any other thing with your monthly paycheck, pretty much. However, the surgery really didn't cost much. So the first time around it was 30 euro, second time around it was 40 euro. How you pay that actually differs a bit. Yeah. The first time around you paid it at the hospital, at the Anmeldung, I think, or with the nurses.
I don't remember.
Yeah. And the second time around we actually got the invoice in our mailbox a few days later, a week later or so.
Yeah, things work differently if you're privately insured. You still need to pay up front the surgery, mind you, the whole price of the surgery, not just 10 euros. And how you pay for this, it also depends.
Well, most likely you will get an invoice. Again, to your mailbox. And then, so I interviewed my dad a little bit about this, and what happens with him is that he gets the invoice. He usually has a due date for 30 days to pay it. And when getting the invoice, he already sends it to his insurance, and usually the insurance takes a week to 2 weeks to pay it. And once he gets the insurance money, he uses that to pay the invoice. Of course, if for whatever reason the insurance is lower, he would prepay the money and then get it back from his insurance. To give you an idea of how expensive is surgery in Germany, Jen's procedure would be around about 3,000 euros. My dad's procedure, where he also stayed 3 nights in the hospital, was also around 3,000 euros. And the outpatient procedure, where he just went in and walked out, was around 1,500 euros. So we're also not talking about like
50,000
5
euros.
or 6-figure numbers, which you sometimes hear from movies or TV series.
Now, again, to emphasize, after surgery, you will most likely need time to recover from this. And in Germany, you have the right to recover from a surgery from your work as well. Most likely you won't get fired from resting, right? And of course, you will take as much time as you need to recover, and it will be paid. Your salary remains the same, right? So in order for this system to trigger, then your surgeon will most likely give you a sick note, which you need to hand in to your both insurance, your employer, and you get a third one for you as a copy. If you're curious on how the sick notes work, then make sure to check out our video on how doctors work, which we link up here and down there.
And our written guide specifically about sick
yes,
period.
We also have a specific guide. We also have a specific guide just about sick note if you want to go into more detail about that as well. It's our hope that you will never need a surgery, whether you're in Germany or somewhere else. However, if you are in Germany and you do have a surgery plan, we hope that this information will help you prepare for it more smoothly. Now, if you're curious on the differences between private and public health insurance, which one is right for you, what should you do, then make sure to click on the video that's here on the left. Until next time,
cheers!
Additional to that, of course, bring your hygienic problems, your hygienic products. Let me do that again. Bring your hygienic problems, but like what even said hygienic, okay.